Now, similarly, Director, Advocacy and Resource Mobilization Uniting to Combat Neglected Tropical Diseases, Stuart Halfort, says Nigeria alone will require about 2 to 3 billion US dollars to eliminate NTDs. Speaking to newsmen in Abuja during the second day advocacy meeting, emphasized the importance of eliminating NTDs to improve health outcomes. Elizabeth Kasham was there in our report.
The Director, Advocacy and Resource Mobilization Uniting to Combat Neglected Tropical Diseases, Stuart Halfort, stated that they are collaborating with several donor countries to secure funding for NTDs and expressed hope that Nigeria will prioritize this within its budget allocations expected next year, July.
Lost productivity equates to something like 19 billion US dollars. For Nigeria alone. If Nigeria could eliminate NTDs by 2030 as per the SDG targets, a study done by Deloitte last year basically suggested that 19 billion US dollars would be added back to the Nigerian economy in increased productivity. So there's a lot to make sense in investing in NTDs.
Other state commissioners for health at the meeting highlighted health challenges, noting that they will continue to draw attention to these diseases through innovative financing mechanisms.
In Abia State, we have 4 endemic entities. We have onchocerciasis in 17 local governments, lymphatic filariasis also in 17 local, that is endemic in 17 local governments. Then we have soil intestinal helminthiasis that you find is endemic in 16 LGs out of the 17. And then in 33 wards in Abia State, we have schistosomiasis endemic. So these are the 4 major NTDs that are prevalent in Abia State. Now in 2012, Abia State engaged a mapping, a case mapping across the state, funded and supported by the Carter Foundation.
The NTDs are so called because they haven't received appropriate attention and funding over the past years. But unfortunately, until and unless we can rally to refocus on them, we will not be able to achieve eradication as we have been intending. So, while the funding required is quite huge, as you have pointed out, it's not something that the Ministry of Health, Federal Ministry of Health and the State Ministry of Health are taking lightly. Efforts are underway to channel available resources towards attacking them and eliminating them.
Nigeria is one of the few countries that develop and review its NTDs Master Plan 2023 to 2027, which was launched in January 2023 and is being used as an advocacy tool by all stakeholders towards attainment of 2030 targets. The country supports efforts to engage with disease epidemic countries, stakeholders and partners. It is gladdening to note that substantial progress has been made over the last decades, as evidenced by some major achievements such as winning of 35 million people of ivermectin treatment in 10 transmission zone states in the country had been recorded. Elizabeth Kasham, ASO Television News.